All right, Eric Beard here to talk a little bit about the importance of internal hip rotation and how to find when there's a restriction within your clients. One of my trainers here, Mariana Conway, is going to help me out. This is in response to a question I had with some of their athletes feeling tightness in their groin or adductors during some of their field work. So Mariana is going to go ahead and do an overhead squat for us. And Mariana's got a pretty good overhead squat, but what I'd like you to look at when she moves is just her knees. So Mari, you can go a little bit faster than you did in the practice for this, go up and down. Now we see a little bit of movement in the right knee and maybe a little bit of shift where her body is going towards the left. Mari, can you show us a posterior view now, please? Go ahead and squat. If you look, her hips don't necessarily come down equally. There's a little bit of a different shift. You might see a little bit of wobbling in that right knee. So Mari, let's have you go ahead and lie on the table. So we can spend a lot more time on this, but this is just a kind of a quick reference view. And then go ahead and lie back, Mari. Beautiful. So if you see that, we're going to look for equal rotation in the hips. Let's look at the right hip. Make sure we're lined up. That's good enough. Let that relax and put the hands here. So you can do this with your clients. Just make sure with the hip rotation, you want that angle for me, because we're going to check. Make sure that the knee is right, lined up over the hip joint. First, you're going to check external rotation. Look for that kind of soft end feel. Don't force anything. Now, Mariana's got pretty good external rotation in the hip. Should be about 45 degrees. She's about 42, 43 right there, just by an eyeball. And then if we come here and check internal, it's not if your camera is not sticking, your computer not just functioning, it's just not moving today. So external rotation is pretty good. Internal rotation, you should about match that. So this is good. That gives you some area to focus on. This is talking about one muscle, Adductor, Magnus. Tomorrow, let's have you come up here. We'll switch. And if you're finding your clients with their knees moving excessively during the squat and they're limited in internal rotation in that position, their Adductor Magnus is probably tight. This is what you can do about it. Pretty good there, Mari?
Yeah.
Okay. So we're going to start on the foam roller all the way up by that ischial tuberosity, that sit bone. Start square off like this with your femur and your toes pointed towards the side. You're going to roll back and forth. This is going to get the top of the hamstrings and the adductors. And then from there, once we turn towards the inside, we're going to be able to get into Adductor Magnus a little bit more. So you're going to turn this way, put a little bit more weight into your left thigh with your body weight. We're going to be getting the top of the adductors, particularly Adductor Magnus, which we saw was restricted in that movement right there. So use this just like we would for other rolling techniques. Move slow and steady till you find a spot that's sore. Stop on it and hold it for about a minute. But pay attention to the position of this femur. We're going to start out with it neutral, and then you're going to internally rotate it. And that's what we're going to get, that internal rotation at the top. So let's stand up and talk for this one more minute. So if your clients or athletes are feeling tightness in their groin, or you're seeing movement at that right knee, check their hip internal rotation, and you can try that roll there with the Adductor Magnus to loosen that up. Thanks for watching. Have a great day.